Welcome to Zashin Zone, where I talk and hopefully you enjoy the show. Let's begin. Alright, healthcare reform. Make America great again. The Affordable Care Act has been a disaster financially for the country. While it did some good things on a personal basis for people in getting their health care, financially it's been a disaster. We're seeing higher and higher double-digit increases on costs and decreases on what you can afford to actually use of your health care. There, talk to any of the Republican candidates, they want to repeal Obamacare pretty much first thing. So this is his plan for after they get rid of it. Right here's the big part of it. However, not enough to simply repeal this terrible legislation. We will work with Congress to make sure we have a series of reforms ready for implementation that follow free market principles and restore economic freedom and certainty to everyone in this country. Following free market principles and working together to create soft policy that will broaden healthcare access, make healthcare more affordable, and improve the quality of care to all Americans. Rhetoric. I'm sorry that I just when it comes to the healthcare, a lot of it's the standard rhetoric. His idea to get the prices down is to get rid of the lines between the states, allowing full competition in the market, which will cause costs to go down and consumer satisfaction to go up. And then take for individuals that buy their own health insurance that they can get the same deduction that their business is allowed, and employees who receive their health insurance through a business is allowed to not get taxed for it. Why should people that buy their own personal health insurance get taxed when people who get it from their employers don't get taxed on it? It's a screwy thing there. This helps level that a little bit. Right here, when it says review basic options for Medicaid and work with states to ensure those who want healthcare coverage can have it, that basically means if help the lower income people that can't afford to get their insurance get on Medicaid. Health savings accounts. Now, see, this is something that employers offer their employees. It's not the way they're set up right now. I'm not really too happy with it because if you put the money in it but you don't use the money, it doesn't roll over all the time. So you can end up losing the money you put into the HSA to help with your taxes. So it's HSAs have a little more ironing than what he's saying here. They're not as flexible as he would think. All right, price transparency from all healthcare providers. As long as the insurance is there, you're not going to have great price transparency because the insurance organizations don't want you to know how little they pay the same thing that you have to pay a lot for. A prime example of this is back when this was around 2005. I had kidney stones, had to go get an MRI and another test. When I asked how much it was going to cost, they quoted a price of approximately $5,500. My insurance paid exactly $500, $250 for each procedure. Okay, my price, if I would have been paying it out of pocket, $5,500. Insurance's price, because of their negotiated deals, $250 each. They don't want people knowing this. This is the sort of thing they want to keep on the down low so that insurance is happy and the medical hospitals are happy, and it's just got its problems. Remove barriers to entry into free markets to drug providers, safe, reliable, cheaper products. Here's a problem, because this year they're wanting to allow foreign countries to send in drugs, which I understand can get cheaper. But one of the things with our drugs right now is it's all covered in the FDA, the Federal Drug Association, FDA, Federal Drug and something. But anyway, it's controlled, it's protected to make sure we don't have. My worries are if we start doing this outsourcing to other countries, we can end up with some problems. Again, it's a good idea, just better make sure they watch on it close. All right. Enforcing immigration laws, eliminating fraud, waste, and energizing the economy, relieve the yeah. Streamlining. Enforce immigration laws, and this one, 11 billion annually. If we don't have the illegal immigrants, we ain't got to pay for their health insurance. Makes sense to me. Bring jobs, capital and jobs back. You got people can afford it. Best social program has always been a job. Problem is, we need jobs that are big enough to bring health insurance with them. McDonald's doesn't pay for health insurance. Fast food doesn't pay for health insurance. We are growing jobs in the service industries. We are not growing jobs in manufacturing and IT, where a lot of that stuff is expensive enough that they still have insurance with it. So hopefully he can get our manufacturing base invigorated again. Mental health and institution. Okay, mental health since the 60s has just basically collapsed in America. Mental health is used by welfare to keep people on welfare and ignored by companies because they don't want people going to get mental health, because mental health costs money and has little benefit to them as far as they're concerned. President has leadership skills to change it. There, I went over his little thing there, but now I'm going to give you my rant. Actually made some notes here on this. In the late 80s and 90s, I was asking how the housing and medical markets could keep going up faster than people's pay. In 2009, we saw the housing bubble burst. Now we're sitting on another bubble in the medical market that Obamacare has only quickened. If the Democrats win the election, I honestly believe we will see the medical market collapse before 2020 and another depression recession with a super slow recovery for another decade. But don't worry about the banks or Wall Street, folks. They'll be doing just fine. And I believe that because the banks and Wall Streets, what do we hear in the news right now? They're buying gold, they're buying silver, they're hiding their money still. Wall Street is just like the banks. They're going to be doing what they got to do to protect themselves from whatever happens in a downturn. Healthcare reform has to happen, and it has to happen to control the price of healthcare. How they're going to get that through their minds in Washington, I don't know. But that's the problem. It's not that healthcare in the United States is bad. It is that it is exploding in cost at a rate that is unsustainable. Trump has a plan. I'm not sure if his plan exactly addresses everything that needs to be addressed, but this is my coverage of it. Sorry it's not the most quantified or qualified, but it's my opinions there. This is Ashen. A little bit of a rant on this one. Please like, subscribe, favorite. There'll be a link to my Amazon affiliates. Yes, I've monetized the video, but it doesn't actually pay anything because I'm still just starting my channel and I won't get that many views anyway. Have a good day. Stump for Trump. Vote for Trump, because if we get a Democrat in there, I don't care if it's Hillary or Bernie, we're screwed.